Good morning, everyone, and welcome to another one in the series of our Healthcare Spotlight series. We'll be going through the emergency department function today and how we can work on digitising and making some improvements in that function. Today, I've got help from data capture experts. The idea here is that Leanne, obviously a seasoned professional in the background and operational functions in health, and Nalika, who's actually been providing solutions of a technical nature inside of health for a number of years as well. Hello, Leanne. Hello, Nalika. Thank you for joining me. We are trying to stick to the kind of 20-minute timeline here. At the end, we'll cover off a little bit about our next series and also the 30-minute free consultation that data capture experts are offering for attendees of this event, this webinar. So, by way of introduction, Leanne, can I ask you to give us your little soundbite of what you're doing and your role there at Data Capture Experts?
Thanks, Mark. Yeah, my role at Data Capture Experts is that of an account director. Means I get to work with all of our customers quite closely. So any of our existing customers, but also any new and future customers that might have an interest in the sorts of work that we do. But I also bring that clinical experience and the healthcare service knowledge that I've gained over just a few short years to the organisation, so that we can really marry that connection between healthcare and how it needs to be delivered with the technology.
Great. And Nalika, what's your role there at founding member of Data Capture Experts?
Thanks, Mark. I'm Chief Technology Officer at Data Capture Experts. My background is technology, and I've been working with a number of healthcare organizations over the last 10 years with digital health and digital transformation initiatives.
Excellent. That's fantastic. And my role in this is obviously I'm interviewing the team here, but also I've been in process improvement generally for about 20 plus years. And my focus, obviously now working for Kofax directly, is to help inside of the healthcare function and industry. So I find it's always interesting talking to the two of you, gaining your insights into what is happening, and hopefully today will be more obviously focusing on the emergency department. With that in mind, I'd like to launch a graphic here, Leanne, that I'm going to ask you to talk through to sort of give it's a simple graphic, but hopefully you can talk to this just to give a feel for where we're going to talk to as far as the pros and cons of the challenges in the emergency department today. And we'll probably drill down a little bit on that after you give just a brief explanation of the function.
Totally. Thanks, Mark. I guess everybody knows about the emergency department. We've almost all been there or know someone who has. And I think if we're watching the news over the last couple of years, what we're really seeing is that huge impact of increased demand on emergency departments across the country and across the world. We know that right now emergency departments are busier than they've ever been. They're more understaffed than they've ever been, and they've still got to do their job. And their job is a very difficult one, and it's been done. And they're exhausted. You know, they're having to wear PPE all day, every day. They have done for a couple of years now. And, you know, when this started, we all thought that would only happen for maybe a few months, but it's been a very long time for them to keep going at the rate and the pace that they are. Just sort of looking at some recent data in 2020 to 2021 year, there were 8.8 million ED presentations in Australia. So that's around 342 presentations per 1,000 people in the population. So that's a really high number. We know that ED presentations have been increasing about 3.2% year on year for the last little while. There was a quick dip down at the beginning of COVID when people were too scared to go to the ED, and they were stuck at home during lockdowns and all sorts of things. But that increase has absolutely continued and then progressed beyond the standard 3.2% increase. So we know the demand is there. We know the staff are tired. Staff are exhausted, wearing that PPE, been working at the rate that they're working at with higher demands is really impacting on their ability to continue to staff every roster. We know that at the moment they're having staff shortages because people have got COVID. Now that COVID's out in the community, the nursing staff and the medical staff, the porters, the admin staff, they're all getting COVID, so they're in isolation. Many of those staff are parents, and so they've got children who've got COVID or symptoms of respiratory illness, so they can't go to school, they can't go to childcare. So those people are also having to stay home. And as well as, there's this great resignation that's happening across the country as well. And so people are leaving these professions in droves because it is hard. They're exhausted. It is very stressful. It's an environment where they're not often thanked for the work that they do. Sometimes they are, but really often they're not. They cop quite abusive behaviour from our community. So it's a really tough place to work, and being able to meet both this increase in demand, this decrease in staffing is really where the healthcare crisis is actually happening at the moment. And ED is just sort of the obvious part of the hospital where this crisis is, but it's the really obvious one because there's just so many people needing their care these days.
That stress point of, if you've got to deal with paperwork plus the care of the patient, I mean, you're trying to do the right thing, but you've got to make sure the information you've got is correct and validated. So in my mind, I mean, that's why I'm not a nurse or a doctor in these situations. There's a lot of multitasking going on there, right? And you've got to at least try and make some of those activities automated so that obviously there's always time pressure, right? Because you're in an emergency, of course, time is obviously a key element there. And then obviously doing the accuracy. From my perspective, now, like, I'm going to ask you a question here, though. When I see emergency department and I see that graphic, I'm trying to understand, like there seems to be a lot of, obviously, things on people's hearts and, all those monitoring systems for the patient themselves. But what do you see technically you're in with DCE that you're actually able to bring to the table, people should consider when actually probably trying to digitize this to the next level?
When it comes to emergency departments, obviously there are key outcome measures that everyone is looking for. And obviously examples like mortality and avoidable readmissions within 24 hours, within 3 days, 7 days, etc. The patient experience as an ED patient, and also the clinician and staff burnout. So the purpose of technologies in the ED department is to optimize the patient flow and reducing the wait times between the activities that happening within an ED department. To give you some examples, a patient when presented to ED, there's a waiting time for a doctor, waiting time to see in, and there's a waiting time waiting for a test results to come through, and waiting for a bed, or waiting for a specialist, or waiting for a social assistant. And so all these activities contribute to the length of stay. And often what happens within ED is because of the activities that happen within the hospital, or could be outside the hospital as well.
So that's interesting. So there's documentation, there's bottlenecks. These things to me sound obvious, but from a health professional, they probably think it's a part of their job, and the digitization probably doesn't exist. Is that a fair statement? I mean, like, you're saying it to me, and I hear, wow, yeah, there's documents, there's people still writing on pieces of paper, still clipboards going along in this day and age. Why are we still doing that? But yeah, so you're promoting the idea that there's an opportunity there to digitize those documents and the workflow and the processes.
That's correct. Often, if a patient arrives with the ambulance, obviously it comes with a set of documents. The first and foremost, we need to digitize those documents and make it available as soon as possible within the electronic medical record, or the patient record, so the doctors can view it and make informed decisions about the next steps. And often in ED departments, there's what we call a triage, and make that triage digitalized and make it electronic form, make it much more easier for everyone to see, and get specialized advice, and specialists which could be physically present or could be remotely can assist that in that particular triage scenario. And based on the statistics, like 67% of ED presentations typically finish within 4 hours. So what that means is that it's very important ED departments produce an actionable complete discharge summary and make it available at the point of discharge, and make it available back to the GP and the allied health professionals and social workers, so they know what the next step should be. These are the points where technology and digital can help in terms of improving the process and the ED workflow.
When you were saying then, I also thought in my mind, a typical document trail is normally step 1, step 2, step 3. So it has this really flat linear process. But I'm sure that if you digitize it, you could do 3 steps at once kind of thing. So multiple resources. So do you see a time or element benefit in that process, Leanne? Like what happens in your experience from day to day versus what the opportunities are to digitize there?
Yeah, you're right. Normally, often things do go in a linear pattern, but in actual fact, if we think about all the things that we want to do with a patient, there'll be blood tests, there's radiology, they might need an X-ray or a scan, we need to order meds, we need to ask an allied health professional to come in for a consult, we may need a specialist consult. You want all 5 of those things to almost happen immediately at the same time, because otherwise you're waiting from one to the other, and then that's what slows things down. Where if you can get the notifications out that these are the 5 things that need to happen with this patient now, do that really quickly, you'll be able to gain some time. And of course, if you can gain time, usually it equals better care, but also it means the next patient's not in the waiting room as long.
Yeah. I mean, I'm only surmising from some of my experiences. We've all probably been in an emergency department at some stage for good or bad reasons. But I'm thinking of the process of, like, I'm in the process, having some type of emergency care. So my documents have followed me, hopefully, or my digital sort of information. But then there's been one nagging thing for me that I'm only coming to grips with, and that's the discharge process, right? Like, I feel like I'm okay, but I feel like it takes me 6 hours to get out of the place. Like, I'm sure that there's some resources checks and balances, but do you see a benefit there on digitizing that at all?
Absolutely, that's crucial in actual fact, is getting that discharge summary, those discharge messages out to the rest of the people caring for that patient. The example I want to use is a cancer patient. So someone who's got a cancer diagnosis of some description, and usually it's the side effects of the chemotherapy or the radiotherapy that have become quite acute that mean they need to come into the emergency department. So they'll be treated initially by the ED staff, but once that episode is over, you need to tell the oncologist that's caring for the patient, the radiation oncologist, maybe the surgeon, depending upon how long ago surgery was, the nursing staff that are looking after the patient in the chemotherapy unit, the allied health staff that are looking after that patient as well. There's usually 1 or 2 of those. So they all need to know about what's just happened in that emergency department, preferably as soon as possible, because that patient might be scheduled to have another radiotherapy treatment or another chemo treatment in the next 24 or 48 hours. So everybody in that care team needs to know what's going on as quickly as possible. Also the GP doesn't know that any of this has happened, so they need to know. But the patient needs to be able to walk out of that emergency department presentation feeling as though their care is being handled by the team, and that the other people looking after them know what's going on and what to do next. So it's not up to the patient to worry about that anymore.
Okay, thanks for that, Leanne. Look, in my mind now, I've got a kind of an idea of the flow there between all the possible elements of, I suppose, the benefits of documentation. We probably haven't really spoken about even remote access, because in the day that at the moment, there's a lot of people, those specialist skills might not be able to be there at the ED. So to connect them into the process is another bit. Is there anything else that you see that's important as far as an opportunity to digitize in this ED process that we haven't had a chance to speak about yet?
Yeah, look, the other element that is really important is actually reducing the number of avoidable presentations. So we know that around, I think it's around 10% of ED presentations are non-urgent and about 37% are semi-urgent. So these are people who probably don't need to be in an emergency department, but they've gone there because they don't have anywhere else to go. So it might be because there's a lack of GPs in their area, or they just don't know how to access that care. So as a collective society, we really need to think about how else can we do this rather than have everybody going to the emergency department. There's got to be other options. So things like virtual EDs are something that have started up. There's one in big one in Sydney, big one in Melbourne as well, and they're seeing 400 or 500 patients a day virtually. So patients in their homes on a video consult to a doctor or nurse in an emergency department. And even paramedics can link into that as well. So if they're with someone in their home, rather than take them into the hospital and have them wait, they could do this virtual consultation. The other things that are coming around these days are things like the Better at Home initiative in Victoria. So that's looking at how can we provide all sorts of different services to patients in their home, either by phone consults or video consults, or adding to that the remote monitoring. So the remote monitoring is things like a thermometer or a pulse oximeter or a blood pressure cuff that you have in your home that sends a digital message to a system somewhere, and that data can then be collected and captured and used by the clinical care team, so that the closer an eye we can keep on these patients, the better chance we've got of keeping them out of hospital in the first place. And so if we can avoid all of those people with chronic diseases, with COVID's where we started all of this, right? So, any of those sorts of patients, even some cancer patients, we're doing lots and lots of chemotherapy in the home these days, remote monitoring of cancer treatment side effects and those sorts. There's lots of stuff that can be done with patients out in the community, so long as we can capture the data and monitor them that way. And that's the real key.
Yeah, so you're capturing data from multiple elements, right? Capturing it from the documents, you're catching it from these machines or let's say devices, electronic devices, and to collate that to the patient. Obviously, there's got to be time and speed benefits there for sure, right? As far as being able to share it. Of course, security plays a little bit of a part in this, as it always comes up, the medical record of the patient and all of these things. Nalika, with your IT experience and skill set, is security an issue, or how do we talk to security and these kind of workflows in the health industry generally?
Obviously, the patient record and the data should be able to access securely and remotely using any device, and that's part of the holistic end-to-end care coordination. And security plays an important role here. Obviously, the measures to prevent ED visits are very important, and in the areas of mental health, drug and alcohol, dental, and asthma, all preventable ED admissions. That can only be done through an end-to-end care coordination or we call continuity of care. And that should be the long-term goal to reduce the workloads on ED.
Well, I think anything that we can do to help, I suppose, the pressures and stress in the ED department, emergency department, we should definitely look at, right? And if digitisation, we're living in this world where the technology's there. It's capable. It can make us move faster, quicker, more efficiently, get information into the right hand to the right time. And this is just one of those areas that it's been really interesting talking to the two of you, because I've learned a little bit more too about, I suppose, the workflow of that patient in the ED area, where your information, your documented information is important to make sure it's getting into the right hands. If we can turn that into a digital flow, then obviously we get benefits of being able to improve the process, transparency, making sure it's happening fast, quick, and accurately, right? So we can actually probably have, get some, I suppose, checkpoints and business rules in that process once we've digitized it as well, so to relax the pressure of those resources when people are actually servicing that patient and that need. So yeah, I've got a lot of ideas buzzing around in my head, and I'm sure there's probably people on this call, on the webinar as well, that have probably got some interest. So I'd like to wrap up by offering, I suppose, the 30-minute consultation that data capture experts are actually offering in this process, and hopefully during this consultation, you can get a better insights into the experiences and insights from DCE themselves. Leanne, can you just give your soundbite of what you're offering there for the consultation?
Yeah, look, and particularly, I guess, relevant to this webinar, you know, if you're looking at anything to keep patients out of hospital, whether you're looking at a virtual emergency department, a virtual clinic, looking at doing some remote monitoring, those are the sorts of things, absolutely, you should give us a call and just talk to us around what are the options available, where are you at, and what is the gap, and we can sort of work through where technology could really help to get you to that next stage of your project or the next stage of your strategic plan.
That's excellent. Yeah, no, I thoroughly recommend getting involved in that 30-minute consultation. Obviously, we're all used to the QR codes, but of course, any questions from today as well or any follow-ups, if you could just email to the mailbox.asia@cofax.com. We're monitoring that, and we'll make sure that we summarise those questions and get answers back to you ASAP. Well, thanks again, Nalika and Leanne, for helping me through this webinar today. Your insights are always very insightful for me to learn, and hopefully for the audience as well. Just to remind people, we do have 2 more left in the Healthcare Spotlight series. Make sure you register for those events. If you've missed out on the ones previously, they should be available on our website as well for you to go back and have a look at those. And of course, anytime, just email those questions or email some follow-ups or requests. Of course, we're here to help as much as we can. Thank you all once again for attending, and hopefully we'll see you in our Healthcare Spotlight series. Thank you very much.